My name's Dr. Masembe Sezalio. I'm an obstetrician gynecologist and a fertility specialist working with Neocare Clinic and Fertility Center. I also do lecture in a number of universities, including Mbarara University of Science and Technology and Kabale University. Today I will be talking about IVF, in vitro fertilization, which is one of the techniques in assisted reproductive technologies. So this is a technique that has been around for some time to help couples achieve pregnancy, especially where other simple methods of fertility treatments have failed. It basically involves having gametes made in the lab, and these gametes are the sperms and the eggs. So I will be taking you through the process of how this takes place. Then the people who benefit from this, the indications, who are those people that need IVF, I also describe that. So who are these people? If we have men with sperm problems, either the numbers are very few or the sperms are unable to move to meet the sperm, to meet the egg, those will need IVF. If we have men with the erectile dysfunction or sexual difficulties, still having their sperms processed and used to fertilize the eggs in the lab is the way to go. Then we can also use this technology for people who want to preserve fertility. For instance, you may have a man who has a cancer and is going to undergo treatment with those drugs that can destroy sperms. We know most of the cancer drugs can destroy sperms, so we can take off these sperms, freeze them and keep them in the labs, and these sperms can be later on used. There are some men whose tubes are blocked. We know sperms are produced in the testicles, and these sperms go through channels and later on are ejaculated out. Sometimes the tubes are blocked, so that sperms can't flow through. So for such men, we pick sperms directly from the testicles and we use those sperms through IVF to achieve a pregnancy. We also have female factors, and the most important female factor is tubal blockage. We know the female genital tract or reproductive system is made up of a uterus, the tubes, and the ovaries where eggs are found. So eggs are supposed to move from the ovaries through the tubes to meet the sperm and later on back into the uterus. So if tubes are blocked, it means sperms and eggs cannot meet. So in such scenarios, we have to do IVF, where we pick eggs directly from the ovaries and then we fertilize these eggs in the labs using the sperms. So in that case, IVF is the technology that we use to achieve pregnancy. Sometimes we have other factors where eggs are very few. There are some women who have very few eggs, especially those who are growing older, above 35 to 40 years. We have a reduction in their ovarian reserve. So in such people, we want them to conceive very fast, and IVF is the way to go. We also have issues like cervical factors, where the cervix is hostile and sperms cannot go through. Again, in such people, IVF is the way to go. Then there are those who have structural difficulties with their reproductive system. Okay, for instance, you may find sex is impossible. Maybe the genitalia are not able to perform sexual intercourse. So in such people, we do IVF. There are some people who are born without a uterus. Okay, and in those people, we do what we call surrogacy, where we fertilize the eggs from this woman, but the embryos are grown in the uterus of another woman. That is called surrogacy. Then we have what we call egg donor IVF, where we have a woman without eggs at all, and we have to get eggs from another woman fertilize them, and then implant the embryos in this very woman without eggs. So in that case, IVF is the answer for such a woman. Then we have also fertility preservation technologies, which we do through IVF. You may have a woman who is also going to undergo cancer treatment using those drugs that destroy eggs. So in such a case, we can stimulate them, pick the eggs, and we store the eggs in our labs. And these eggs can be used in future for IVF. Then we have genetic problems. Okay, you find in a family there is a genetic disease which is inherited through the family. So such people want to do IVF so that we first check the embryos formed. If they carry any of these genetic diseases before we implant them, we call that genetic screening or pre-implantation genetic testing. So this is a technology that we also do through IVF. Then we have also what we call combined factors, where you find a man and a woman all have defects. Then we have also other issues like unexplained infertility. You find the sperms are fine, eggs are fine, the uterus is fine, but this couple is not conceiving. So in such a scenario, IVF helps. Then we also have other issues where simple treatments have failed. There are other simpler treatments like ovulation induction, timed intercourse, intrauterine insemination. Where all these have failed, we have to use IVF. Okay, because we know IVF has the highest success rates in all the technologies that we know. In a natural cycle where we are not using any manipulation, any drugs, every month each woman has got a chance of 25% of conceiving. When we use IVF, this chance goes up 40%. Of course, there are other factors that will determine this success rate. Okay, and in all the technologies available, we know ultimately IVF is the most successful when all other methods have been used and there is no success. And this is a technology that is within our midst. Many years back, this technology has been scarce and very costly, and it's been accessible through other countries. But for some time now, we have a number of IVF centers in Uganda, and in Imbarara we have Neocare Clinic and Fertility Center that offers this service. So what are those steps we go through when we are doing IVF? This is a question most people will ask you. Some think you're going to cut them, you do surgery. No, we don't. It's a very minimally invasive procedure. So what do we start with? We start with a cycle called the diagnostic cycle. This is a month before we do the IVF itself. And in this month, we do all the checkups that are necessary. We do the checkups on the man, the checkups on the woman, we see the sperm quality, we check the uterus, check the eggs, check the hormones, and we prepare this couple for IVF. That is called the diagnostic cycle. Then after that, we have a step called down regulation. Down regulation, that is when we are trying to normalize the hormones in a woman, because we know a woman's cycle is under the control of hormones, and during IVF we want to be the people controlling the cycles. So we have to hijack the body from its own control so that we are the people controlling the body using our own drugs. So we subject these women to medications that bring their body to a lower level, to the basic level where there is no any hormonal activity. And those drugs usually are started in a cycle before the IVF. Okay, we have other approaches where we don't down regulate, where we simply wait for the periods and we start stimulating. This takes us to the next step in IVF, which is ovarian hyperstimulation. So at the beginning of the periods, usually on the second or third day, we call this lady to our clinic and we start them on injections. and these injections are meant to grow or develop a number of eggs in their ovaries. We know in a natural cycle only one egg eventually reaches maturity, but in IVF we want about 15 to 20 eggs to be able to reach maturity. And how do we achieve this? We subject this woman to injections daily for about 12 to 14 days. Okay, and at the end of time, we are going to be having about 15 to 20 eggs all reaching maturity. And why do we need these many eggs? Is to maximize success. The more the eggs, okay, the higher the success rate. The less the eggs, the fewer the success rate. During these 14 days of injections, we do what we call cycle monitoring. And in cycle monitoring, we are basically looking at how the eggs are responding. And we balance this with the doses that we are giving. So we do hormonal tests, we do scans, and this will be able to tell us how many eggs are growing, the rate at which they are growing, and this helps us to change the doses we are giving. Okay, we want to balance between the dose, the number of eggs, and avoid complications. One of the complications is hyperstimulation, where you have excessive response and you form too many eggs. Okay, and this is associated with other issues which we want to avoid. So we control the cycle. This is why you call it controlled ovarian stimulation. Okay, then when eggs are mature, we give the last shot called the trigger. We give an injection that completes the maturation process and causes ovulation. But in this case, we don't want to cause ovulation. Okay, in fact, we have to prevent ovulation during this cycle, and we give drugs along the way to prevent that. Okay, so that we have all the eggs mature and we pick them before they ovulate. So after giving the final injection called a trigger injection of HCG, human chorionic gonadotrophin, okay, we wait 34 to 36 hours later, because we know after that time eggs are fully mature, and we pick them. So that brings us to the next step in the process of IVF, called the egg pickup or egg retrieval. So this is a simple procedure that we do in theater, and we do it under slight sedation, under anesthesia. Okay, it is painless and it is a very brief procedure. Usually in 15 minutes the procedure is done, and it is less invasive. It is done under ultrasound guidance using a very small needle and with pain control. So after 15 minutes, when eggs are picked, the patient is let to relax. Usually in 30 minutes they have fully recovered from anesthesia. We give simple painkillers and we let them home. Okay, and on the very day when we pick the eggs, we start another process called luteal phase support. This is preparing the uterus to receive the embryos. So we give them other tablets called progesterone tablets, and these are the tablets they start using on the day of egg collection in preparation to receive the embryos. And these tablets prepare the uterus basically, and they support the embryos when they have been implanted. So after picking the eggs, on the very day of picking the eggs, the husband provides us with the sperms. If the husband has no sperms, of course, we'll have known the source of sperms. Some couples may have sperm donors. Okay, we have sperms in our labs sometimes stored. We have what we call a sperm bank, and that is for men who don't have sperms at all, and they have to consent for that. But in case the husband has sperms, he provides sperms on the day when we are picking the eggs. So we fertilize the eggs with these sperms in the lab. That is why it is called in vitro fertilization. That is fertilization outside the body. Okay, and sometimes this IVF was called the test tube procedure, and the babies formed used to be called the test tube babies. And the reason was because the fertilization takes place in a test tube or in a glass. Okay, but eventually the babies formed are not different from the babies formed with the natural fertilization. What we only offer in the lab are the conditions for this egg and the sperm to meet, and we know it is the egg and the sperm that eventually forms the baby. And in the lab we do what we call embryo culturing. After fertilization, the embryos formed are monitored for about 3 to 5 days. And in the monitoring, we see the process of cell division, the process of how the babies are growing, and we keep them usually up to 3 days. And by the 3rd day, we are able to tell if this fertilized egg is actually forming a baby. Sometimes some fertilized eggs don't form babies at all. Some of the eggs fail to fertilize at all, and we do all that monitoring in the lab. So the majority of the labs now transfer the embryos on the 3rd day back to the uterus of this woman. So this brings us to another step in IVF called embryo transfer. So like I told you, we do this 3 days after egg pickup. So it is a simple procedure that takes about 5 minutes. We do it from theater, and this time we don't need any anesthesia, we don't need any pain management because it is painless. We do it using a soft catheter and under the guidance of a scan. So we put these embryos in the uterus when we are seeing the uterus using a scan. Okay, and it is a very simple procedure, painless, and it takes a very short time. And after this, we let this lady rest for about 5 to 10 minutes, sometimes 30 minutes, and then we let them go home. And that basically marks the end of the cycle for IVF. Okay, 14 days from the start of the periods, we should have gone through the injections, egg pickup, egg fertilization, and then finally embryo transfer. And this summarizes the process of IVF. So after embryo transfer, when we send this woman back home, we see her again after 2 weeks. That's roughly 14 days for a pregnancy test. We expect by 14 days after the embryo transfer, this lady to be pregnant if the procedure was successful. And we can check this by using either urine or blood. Okay, and we measure a hormone called HCG, human chorionic gonadotropin, which is produced by the baby formed, the embryo formed itself. Okay, and we continue the process of supporting this pregnancy if the test is positive. And if the test is negative, then we can repeat this IVF cycle. Okay, so I told you the success rates of 25 to 40%, meaning it is not a guarantee that once you do IVF, you go home with a baby. Some people have to try 1 time, others 2 times, others 3 times, others up to 6 times. And the success rates will depend on many factors. The age of the woman is the most important determinant of success. Okay, women who are older than 35 years usually have fewer eggs and eggs of poor quality, and that can impact on the success rates. Men usually their age doesn't become a problem until 50 years. Usually men after 50 years have reduced quality of sperms. So the quality of eggs, the quality of sperms will also determine the quality of the babies formed, and that will also determine the success rate. Okay, there are also other factors like medical conditions. If these men are suffering from medical conditions like diabetes, they're having sperm problems, men who are smoking, exposed to chemicals, all those factors will impact on success rates. The same applies to women if they are having other current medical conditions that affect their eggs. If they are exposed to chemicals like smoking, all these can impact on the success rates. So the success rates will vary depending on the quality of the eggs, quality of sperm. And for us in our labs, we ensure the quality of the conditions in which we do our work. okay, so that we don't have issues in our labs. Also, the treatments we give will determine the success rates, so we can influence things in our midst using the drugs and also ensuring that the lab conditions are stable. But there are other factors beyond the lab, beyond the clinic, which are individual, okay? That is the quality of the eggs and the quality of the sperms. All right, and now others will ask, isn't this procedure associated with complications? There is no procedure that doesn't come with complications, but this is a controlled process, okay? Our role as clinicians is to reduce or prevent complications as much as possible. So the commonest complication associated with IVF is having multiple pregnancies. And this is where we have twins, we have triplets, and other high-order multiple pregnancies. This one, we control it in our treatments. The number of embryos we transfer back to this uterus will determine their likelihood of having multiple pregnancies, their age, their likelihood of success. All these are factors that we put into consideration to prevent that. Of course, many people will tell you they want to have twins, but we counsel them and tell them that twin pregnancies and other high-order multiple pregnancies are usually risky pregnancies, so they are not the pregnancies we would prefer, okay? But in case it happens, we still take care of them in their antenatal times. The other complication is what we call ovarian hyperstimulation syndrome, where the body responds excessively and produces a lot of eggs. And these will produce a lot of chemicals in the body that will lead to fluid accumulation. And this is something we also prevent during our treatments, okay? And if it happens, it is manageable. We manage it. And the risk of it happening is very small, about 1 to 2%. So it is not something to be scared of. Now, another question they will ask, if a woman makes a lot of eggs, and you make a lot of embryos, where do you put the rest of the embryos? Okay, the extra babies, after transferring 3 to 4 eggs back to the uterus, what do you do with the rest? We have what we call preservation. Okay, this is a freezing process that we call vitrification, okay, in liquid nitrogen. At a temperature of negative 196 degrees, we can store these embryos up to 10 years in our labs, okay? And in case this couple wants to conceive again in future, they don't have to go through the other process of injections, monitoring, and so forth. They simply come, we prepare this woman, and then we give her the embryos that are already formed in the lab. And this is a technology that even helps people who don't stay together. Could be a couple that doesn't stay together because of work. Someone stays abroad. So we can do IVF and store the embryos. So at the convenience of their scheduling, they come over and pick embryos from our labs. And this is the beauty with IVF. So with that, I come to the end of this presentation. And I will entertain questions through 8TV, and I want to thank the 8TV company for offering this opportunity. I want to thank NeoCare team for the work they are doing in this IVF, and I want to tell the public, okay, that this is a service that is now available and affordable, and we can offer it in southwestern Uganda, specifically in Imbarara at NeoCare Clinic and Fertility Center. This show is called Health and Lifestyle, and it is proudly sponsored by NeoCare Clinic and Fertility Center in Imbarara, and it runs every Thursday at 5 p.m. on 8TV. Thank you. Always tune in.